So this is one of the new inpatient rooms at MedStar Montgomery Medical Center. It's a medical room, but it's modeled for medical surgical patients. So not the ICU, not labor, delivery, recovery, or postpartum, but general medical patients. And we wanted to show you some of the features that went into the design. And it was an informed design process that used tenets of evidence-based design in addition to a lot of staff input. About 75 different clinicians in the supportive areas, ancillary areas, as well as direct care provision were involved. Everyone from occupational, physical therapy modalities to nursing, transportation, construction, facilities management. Just about everybody touched this project. So the first feature I wanted to share was the flooring. There are different colors that you see on the floor, and they're very purposeful. So this brown area is designed for infection control. The nurse or the clinician enters the room, they turn over here to the infection control station, they gown, they glove, they pump in or pump out on exit. But when they leave this color, this one first color, they're sort of clean, it's sort of ready to go. The green area is the clinical zone, so that's where all your patient care takes place. The nurse can interact with the patient, can do medication administration and just general care for the patient. The purple is a bridge. We call it sort of the bridge to the family zone. So this area we wanted to design to sort of be unobstructed, so you can walk clearly and very confidently without bumping into anything. So the fire brown beige area is designed for the family. So in evidence-based design, there's really a focus on 4 zones. There's a supply zone, an infection zone, a clinical zone, and a family zone. So we demarcated that or delineated that with colors and visual cueing. When you walk into the room, there's hi-hat downlighting, very, very sort of focused light. It doesn't diffuse, it's not very diffuse or bright, and it allows the caregiver to walk into the room and into the clinical area, but it doesn't affect the patient. So there's no bright light that's over the patient. That has to be done with the patient's knowledge and telling, sort of informing the patient what's the intent of the clinician. This is the clinical zone for nursing and other clinical modalities to access medications in this built-in drawer, prepare medications, or anything clinical for the patient, maybe a compress or something that's done here on this seamless Corian countertop. There's, of course, paper towels and soaps, sharp containers, medications. Every room on this unit has clinical documentation that's done on PCs. This is mounted on a wall. There are no carts on this unit, so there's there's more focus on falls and tripping hazards. So this allows the clinician to have an exchange with the patient where there's good eye contact and there's some real discussion that's happening, and it's being documented in real time. The person isn't having an exchange, remembering it, jotting it down, and running outside. It's happening right here, real time, next to the patient. These walls were designed by the clinicians. So the nurses came to us and they said, we don't want to bend over as much. We're having repetitive motion injuries or back injuries. We want to keep things high. So you see that the electrical outlets are higher. That's the attention we paid to our staff. They also wanted medical gas outlets to be on both sides of the patient. So you see oxygen and suction on both sides of the patient. So obviously we have a bed in the room, we have an overbed table. The overbed table doubles as a more or less a chest of drawers. There's some shelving on it. You won't see any bedside drawers in the room. Nice finishes here at the footwall, bulletin boards and whiteboards for letting the patient know what their plan is for the day, who their caregivers are. Again, this was all brought about by our collaborative governance structure here at the hospital. Nursing input really led this architectural and really direct care provision piece. The TVs in the room, again, controlled by the patient, have our educational skylight program, so disease-specific education can be given directly to the patient while they're in bed. Nice finishes here on the footwall, good wardrobe. Again, our focus is on nature, so you'll see that in the art and in some of the sort of bamboo-like features. This is more storage up in here. The nice part about the plan for the furniture, and again, this was all researched by the group, but really decided by the team, was in the furniture. So these are 2 products over here that are seating and furniture, but they're really treatment. They're really devices that can be used for treatment. So this is a standard chair that you might see on a unit, but it has some features that work well for the patient. Number one, it has a drop arm. Makes it very easy to transfer. So we bring the bed down and the patient can move over. The bed actually can go all the way back. So the patient can sit in this chair for a long amount of time. Why is that good? Patients that get out of bed have a tendency of doing better, and they have really a better likelihood of going home faster, which is what we want. We want them to get better quicker. So the nice thing about this chair and what we wanted to do is to create a moment where families and patients can really interact. So this chair moves very easily, and what we wanted to do is to give a definitive, defined place for families. So at first look, it's a couch, but then it's also a place where the patient can be moved in to have dinner, or have an exchange and play cards, or do something with their family and normalize themselves and make it feel like this could be home. Not that we want this to be their home, we want them to be comfortable where they're being cared for, but we want them to simulate what it's like to be back home. So this fits nicely over here. You'll notice all the colors are focused on nature. So you see a lot of greens, you see a lot of sort of subtle tones in the color. This also is a sleeper couch that pops up so the family can spend the night. Again, a lot of focus on the family zone. And while they're here, we want them to be comfortable, so their amenities, we know they have iPads or laptops, so you can see outlets conveniently placed right next to the couches, and a reading light that is right over the couch. So the other interesting thing about the patient service area is the lighting. So we never want to shock a patient with light. So we have lighting that's multi-functioning. This is a more diffuse sort of a light. This is a reading light. You can do one or the other or both. And then if the patient is in bed and a physician or a clinician wants to examine the patient with more light that's more focused, or maybe even do a bedside procedure, we have a function in the light where it's very bright and you can actually do a procedure at the bedside. So all of these functions, from the light that comes in the room, the tinting in the windows, the glazing that we used externally, the flooring, the position of the faucets, the clearness of some of these wall elevations, all happened because staff gave input. And that's an informed design process. And we think we'll really make these rooms successful in the long run. We're very patient-centered here. We put the patient first in everything that we do. And in the design-built environment, we're helping to provide care. So in the build strategy of design, some people think it's just construction or it's just the building. We're actually helping the care of the patient by putting in features that help patients get better.